Today, I am pleased to report 6,106 Albertans have recovered from COVID-19, leaving 679 active cases in the province. This is the fewest number of active cases in Alberta since March 30th. Of course, we must not forget that this virus is still impacting many people across the province. Currently, 43 people are hospitalized with COVID-19, with 4 of those admitted to ICUs. In the last 24 hours, out of 3,168 new test results, there were 25 new cases. Sadly, I must report that there are 2 new deaths today. I would like to extend my sympathies to all those who have lost loved ones during this time. As we gradually lift restrictions, we must not forget that this virus can lead to serious outcomes and that it will be with us for many months to come. While the most severe outcomes of this infection are seen disproportionately in those who are older or who have other medical conditions, it is important for us to be constantly learning of all the ways that COVID-19 can impact our health. In the past several weeks, cases of a new condition called multisystem inflammatory syndrome in children, or MIS-C, have been reported in a number of jurisdictions. It is similar to an inflammatory disease known as Kawasaki's disease and responds to treatments such as steroids. It has been seen in the UK, Italy, Quebec, and the United States. Potential cases are also being explored in other provinces across the country. Today, I am announcing that one possible case of MIS-C is being investigated in Alberta this week. Reported cases across the jurisdictions I mentioned involve children and adolescents with recent infection with the virus, with the syndrome seeming to develop several weeks to about a month after an infection. MIS-C involves inflammation of multiple organs, including the heart, kidneys, blood vessels, and nervous system. Fever is a key feature of this syndrome, and other symptoms can include rash, vomiting, diarrhea, and abdominal pain. The early information available suggests that the majority of children who have COVID-19 would not be expected to experience this syndrome. However, we are making this disease reportable in order to monitor any cases that might occur and to improve our understanding of this illness. We are currently developing guidelines that would allow Edmonton to be a hub city for the NHL playoffs. These guidelines have been developed to support players, NHL staff, media personnel, and Albertans to stay healthy and safe during such an event. We remain open to working with the NHL to address any concerns before these guidelines are finalized, whether that relates to quarantine requirements or any other matter. This will be completed in consideration of existing federal and provincial quarantine requirements that are in place for international travelers that may need to be addressed to accommodate the NHL's proposal. This could include further clarifying the concept of a group cohort for quarantine purposes that is currently in our guidelines, and how this could be incorporated into planning for practices and games. I know Premier Kenny has identified this as a matter that he wishes to resolve in the letter that he sent to the Prime Minister yesterday. Safety must be the top priority. In order to make this happen, all levels of government and the NHL will have to collaborate and find creative solutions. I have been in touch with my colleagues at the federal level to discuss this issue and how we can use cohort quarantine to ensure both public safety as well as safe practices and games for NHL teams. So I want to be clear that with respect to the quarantine rules, the guidelines that we have put in place that we feel would adequately address safety of Albertans, as well as being considerate of the opportunity for sporting events, which we know Albertans enjoy, to take place, that we think balances both of those interests. I want to be clear that we're not talking about waiving the quarantine requirements. In Alberta, the guidelines that we've put together that would need to be followed if the event were to happen here, what we've put together is an opportunity for a cohort quarantine, which would mean that a group that came in from international travel, such as an individual team, would have to stay together in that quarantine period and would not be able to interact with others outside of that cohort group. And as I mentioned, that size of that cohort group, whether it's one team or two teams that could potentially allow play, they would be effectively sealed off from the rest of the community, and there would be no interaction between them and the rest of the community, which, with respect to public safety, is the consideration that we take most seriously. With respect to the double standard with concerning other Albertans who might be coming in from international travel or those who wish to access arenas, as I mentioned, we are looking at including sports and access to recreational facilities under public health guidelines, potentially in stage 2, which would likely be happening before, if this NHL event does come to Edmonton, that would be later in the summer. So I anticipate that Albertans will actually be able to access arenas depending on the decisions that are made, even before the NHL teams arrive, if they were to come here. And we do make exceptions under the quarantine provisions for essential service workers as long as they are allowed to follow certain criteria. So again, other Albertans who can meet very strict requirements are sometimes have an alternate version of quarantine that they work within in order to facilitate certain activities happening. So again, I don't believe that the alternate quarantine provisions put Albertans at risk at all. And I believe that the access to arenas is something that Albertans would be able to do. And if any sports team wishes to engage in competition and is able to abide by the sporting guidelines that we've put together for the NHL to consider, then the same guidelines would apply to them and the same kinds of considerations would apply to them as well.